If you want wide awake, refreshed looking eyes, stay tuned. This is part 2 of what started last week of how to have big, wide open eyes and how I do that with my clients. Stay tuned. That's coming up next. Welcome back. Christine Byer here, licensed esthetician for 22 years. On this channel, we talk about your skincare journey because it's never one thing that makes our face look great. It's a whole combination of things. So last week we talked about, it was part 1 of wide open eyes, or how to have eyes that look really wide open. And today is part 2. So in the first video, we talked about that 4 sides release and how I do this to my clients. Everyday actions. I'm squinting right now as I talk to you. We squint, we spend a lot of time on devices, on phones, on computers, and our eyes take a beating. So what I like to do with my clients is do that four sides release. And if you haven't seen that, go back and watch that because it is so invaluable. It opens up fresh blood supply, it clears out excess lymph, and most eyes are just dying for that right now because they're just so overworked. So in this video, I'm assuming you've done that. So if you haven't done it, it would be a great idea to do that first, because if we don't release the muscles before we lift them, we're not going to get as good of a lift as we could as if we had released them first. So it's like stretching. When we stretch the intricate musculature around the eyes, what happens is it helps them sort of float up and they look awake. It flushes out toxins and lymph. It helps with puffiness. Your eyes will feel refreshed, and like I said, that brow will just lift up, and you hardly have to do anything to make that happen if you do the release work first. So I'm assuming you've done that in this video. So what I love to do is, after I've done the eye rejuvenator and I've done a little work on the eye, I like to end with microcurrent. And I think about the opposing muscles with microcurrent and how to work with the facial anatomy to make those eyes look more wide awake. So how do I do that? You think about what muscle pulls the eyes up. It is the brow. That's right. Those are the opposing muscles. So they go like this and they go like this. The thing with that is that those of you who get Botox know that there's a trade-off with Botox. We can get Botox and they'll go all through here. And what happens? 9 times out of 10, your brows lower a little bit, and that always happens to me and I hate it. So it's kind of like I give up a little bit of brow space. I'm due for Botox right now, but I'm resisting. I'm waiting because I like how my eyes tend to lift up and out more when my forehead is not frozen. So that's important. If you've had Botox, this move will not work. But if you haven't had Botox, this works like gangbusters. And you know, I think in this video that I'm showing, this was from last year, I think, and I still got a lift. I get Botox maybe once a year. I don't know if this was at the end. My brow doesn't look like it, but I still got a little bit of a lift, and you'll see there's a before and after picture at the very end. But you'll see here on the left that those are the opposing muscles. You're either squinting and pushing it down or raising it up. So the microcurrent and just on this frontalis really helps it move up. And you know, microcurrent done on the regular really helps the muscles sort of remember where they're supposed to be, you know, how taut they're supposed to be. Because the brain decides, and I'm talking about this in this video, the brain decides how taut the muscles are depending on how much we use it. And I'm telling a little story about a lady who said she worked in the library, and then she used to read library books to toddlers, and you think about all the crazy faces you make when you're reading a book to a toddler, and it really exercises your face. And she said, and then they moved me to a quieter position within the library, and I noticed that my face fell after that. And I'm thinking, well, of course, you're not exercising it anymore. You're not making crazy faces reading to toddlers. So microcurrent sort of tricks, and it builds muscle too, but it tricks the brain into remembering, these muscles are taught. It retrains and re-educates the muscles. So yeah, there's so many benefits to microcurrent. It's like you'll notice the lift more or less pretty quick, a week or two, sometimes after the first treatment. If you do the release work, certainly you'll notice it. But you'll notice the lift right away, and then with continued use, it thickens up the skin. It even helps with pigmentation, fine lines and wrinkles, and large pores. I mean, it just really adds energy to the skin so it can complete the work it's trying to do. That with age, it gets depleted, that ATP in our cells, it depletes. And so the stuff we're working on, it gets slower and slower, where adding microcurrent is like lending it a helping hand, and things speed up, which is wonderful, because that's what we're looking for as we age, is speeding up cellular turnover, adding energy to the muscles. So that's my trick for lifting the eyes. Lift that frontalis, or that forehead muscle. Take your time with this. Really get the 10-second stroke, and you will see a difference. I use this with my clients a lot. I'll grab 2 minis, and I will just really work the tension out of the muscle. The 2 probes are like a massage, so you'll feel all sorts of grittiness and stuff, and you just work it out. And you're working out the knots in the muscle and lifting it at the same time. That's why I love the design of this mini. It looks so normal, but it's actually quite a clever device. So this is such a simple yet complex trick. You release and then you lift. I always release before I lift to get a more complete lift. Here comes the before and after. The top is the before and the bottom is the after. And in the bottom photo, you'll notice there's more space in my upper brow, and I have a tiny bit more of an arch to my eyebrow. All right. Thanks for watching. Talk to you soon. Bye now.